Hello, once again, this is Dr. Jerry Cuomo. I'm here with another rescue case. This is a Straumann, unknown Straumann. We were given some information about the case. It's a loose implant supported crown, and it is a Straumann. It may be a Synocta Straumann, and we know it's a tissue level. For sure, it's not a bone level implant, tissue level. Patient's not experiencing any pain with it. Just looseness to the crown. Now there was prior access, as you can see, different materials that were used. It looks like not once but twice, and there looks like there was a larger access hole and a smaller one made within that composite. Kind of cupped out anatomy. We're not too concerned about that. Right now, my approach is to just take a high speed, and I'm going to take a 330 burr and a 330, and we're just going to undo the core. So we need a 330 burr. So what we're looking for is anything in metal, but we also our minds are thinking, well, there might be cotton in there, perhaps, or even a nylon Teflon. So that's the next step. So now we have it splinted together. That's what the blue block out is. It just splints the tooth, stabilizes the tooth, and now we'll just try to stay in the middle of our recording. There you can observe. So now I'm just slowly going in, making access. Now we'll just get rid of all this composite. It's not just going to get in the way. Again, not quite sure what we're dealing with, so we're gaining access to explore at this point. Looks like some kind of a flowable composite that was used. You see a little porosity like that. Usually means it's some kind of a flowable material. And it looks like we're coming up against something white. Dental assistant will dry it again. Looks like Teflon tape. Okay, so at least we've got Teflon in there. And we'll get rid of all this other material. It is a metal ceramic crown. We know that. It's not an all ceramic, but a metal ceramic. Possibly a UCLA abutment, perhaps. What I've done was, I went ahead and got some parts together just to see if it could be one of any of these. So this is a solid abutment here from Straumann. This is the Synocta abutment, stock abutment. That's the screw. That would be an abutment screw for UCLA abutment, and another Synocta abutment. You notice the octagon, or is it a Morse taper? We counted the threads. The X-ray shows at least 7 threads. There's 5 threads on a solid abutment. So we're convinced it's probably not. I want to say that we're probably 90% sure it's not a solid abutment. So we're looking for a screw head. Now the previous dentist has in there Teflon. So from their access, and now we're going to remove that Teflon tape. That'll come out. So at least they're more, I want to say up to date on packing material. Okay, so that's out. And now it looks like the screw hole might be more lingual. Looks like there's composite all the way down inside. So now the next thing we're going to do is take a very, 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 very sharp, hand-sharpened Explorer, endodontic Explorer. Going to go down the side, start removing more of the composite. I can see there's something going on here lingually. I don't know what that is. Yeah, it's really hard to see in there, and we understand most of this out here is going to be out of focus. This is what we're focusing on internally. Okay, so we don't know what that is. We're looking at the color of the metal too. I'm going to go internally more now with the microscope. Looking to see if we can identify titanium. There's the lingual. It might be a lingual area. Once we find a cement line or a seam somewhere, we can identify the screw head, and then we can go from there. But it looks like they just went in and just were looking for something. They couldn't find it. But I have a hunch it's toward the lingual. I think I found it. Yep. It looks like something there. I'm going to go lingually and see if it's more toward the palate, where they might have placed the implant. Or it may be an angled abutment, which makes it a little more complicated. Angled abutment. That means the screw's coming in from the side, perhaps. Angled abutment. So we got to open it up internally. So we got to broaden it up, open it up. Let's do the first thing we always do is pre-soak, okay? So pre-soaking first. That is going to be tartar and stain remover. Pick that up from the denture people, otherwise known as TS. A lot of people ask me about this solution. It's like our own crud cutter. You know, we can use this on dentures, we can use it in implants. I'm just working it in there. You know, it's clear, so if it starts to turn murky or cloudy, then we know it's doing its thing. You know, it's cleaning. Kind of like our 4019, you know. There we go. Now you can also see metal better too, see, because there's stuff in there. Filings, bioburden. Things that get pushed on the metal, and the metal acts as like a sponge and it just sticks to it. So you want to clean it off the metal. Get it all cleaned off. And we go in with a microsuction next. And you can actually see microsuction X. Oh, okay. Okay, sorry about that. I thought you were going up in there. You alright underneath? Okay. Okay. So you see that lingual right there? That almost looks like a star screw right on that lingual. So I'm gonna venture down there. It looks like it. But why lingual? You know, usually you see for premolars, the screws are vertical. They usually go vertical right through the top. But again, it could be the bone that, you know, you gotta put the implant or bone. Look at all that. There's composite all in there. That got all the way down and then locked things in. So it's composite. There it is. That's the screw. Looks like it. Could be wrong. It looks like it. I don't know what else that could be other than the screw itself. I don't see anything toward the buckle at all. No, we gotta go lingual, and there it is. There's a screw. It's an angled screw. So this is an angled abutment. I mean, it's almost 30 degrees right through the buccal cusp. So my approach now is to open up the buccal a little bit more and then come down and open up the lingual and just try to pass a driver. Angled it in, and then we'll try to get it unscrewed. Let's look around and see. Now I can't see underneath. Let me get a small mirror. Just looking to see how this might have been placed. So here's my other mirror. Looking underneath. So it's all the way. Can we have a perio probe, please? So here, that's the lingual. And that's, can that be? Yeah. Anything's possible. Okay, I'm gonna go, I mean, that's my perfect lead. I can see the head of the screw right there. It's right there. Find out what that is though, for sure. This in the middle. Let's zoom right in on this middle portion. It looks like the abutment itself, and this is the crown above it. After getting I'm going to pre-soak it a little bit more. Used new. Yep. So we'll get some separation here. So if it is in fact a cemented implant, it probably was a cemented implant, and the only way to know is if originally if it didn't have an opening in the crown, then we know it was an angled abutment, cemented. Today we try to make them all screw retained unless the screw hole is going to go through the buckle. Done a lot of these, haven't seen many bicuspids. Had some severe angled cases, but pretty rare. See that? Oh, looks great. Now I can see so much better in there now. It's just the composite doesn't dissolve. That's the only problem. And that's what's down in there. So we're going to use a very, very, very small diamond. But before we do that, I'm going to continue to remove a little bit more toward the buckle so we can gain the sight we can see. We want to get a straight line access going in there. Okay, so here we go. Okay, so I'm going to use water. So this is just a very, very fine diamond, and we're just going to come toward the buckle. Okay. Alright, and we'll rinse it out thoroughly. And dry it out thoroughly. And we're just going to come right in with tartar and stain. So I can just fit the shaft of my next drill, which is going to be a 1/4 round burr. And that I'm going to bring right over on top, not touching, but I'm going to bring it over on top of the screw head. Alright, and we'll suck that out now. So, you know, you have to have a little more funnel, a little more room to the funnel shape of the prep in order to reach, you know, I want to be able to reach around the back end of the screw head. Almost convinced that's a screw head. It looks very, very familiar. Well, we'll see. Let's see what it is. Oh, something else just opened up. That's nice. Oh, okay. So now it's starting to shape a little better. We can see better. There we go. Now we can see better. So you see this now opening now up around the lip here. And a little lip there. And then here's all composite. So let's say we can pick that out of there. And on out of there. Composite. You can see it's nice. So that's what's blocking. If it's a screw, it's got composite around the head. So this was cemented, and what they did was they just didn't block the screw head. They just cemented right on top of it, figuring that would lock it in. Never have a problem, you know. If that is the screw head, it's starting to look more like it. All right, so we need to expedite things now. So we're going to go ahead with our drill setup. We're good on that? Okay. Checked it. We're ready. Okay. 1/4 rounds first. This is not a very long prep, so it's easy to reach with a regular change of head.
Yep, it's all changed.
This will need a smaller diameter.
The vector Germany one.
Yeah, they're all different sizes though.
That's the only one I have for
Okay, bring them all out then. We'll do it again. So we'll take a little break here. We're just searching for a couple of things. All right.
all of this, those ones.
Uh-huh, yeah. Please. Actually, no, I'm just going to try to get some of this composite freed up. Yeah, that's what it is. It's It's composite wrapped around the head of the screw, and it's all toward the lingual. It's pretty thick composite. Okay, you're right. Trade you. Yeah. Okay, back at it. Alright, so this is a quarter round. And you can see how white that is? That's composite. So I'm just cleaning the composite out from around everything. Okay. That's the step one, and then as we start to clean it up, getting rid of the composite slowly, I'll use an instrument, maybe every 2 passes, start using the instrument. And still got some more composite there. Okay. Okay. Now we'll go back in and use our soaking methods again. And we'll suck that out. Okay. Turn that in a little bit. And you can see there's some more composite, and there's our screw right there. So now we've got the roof of composite to remove. I'll get that off with the scaler, perhaps. There's a big chunk coming out. So I'm kind of de-roofing the composite, gaining more access. I'm now gonna come in lingually a little bit. And there's your screw. So now we found the screw head. It is a hex screw head, but it's intact. Okay, but it's going to come all the way out the buckle. So that's amazing. Actually, it's through the mesial buckle aspect. So, the good news is we're going to save the implant. I mean, at least it appears that way from here. Let's see. I'm going to pre-soak that screw. Let's see if the screw moves before I do that. A little more cleanup here. Okay. Yeah, it's an angle shot, so we want to rescue the prosthesis as well, but I don't know. I'm starting to think in my head what What else could we do to salvage? I'd have to drill a hole through the crown and then maybe patch it later, or just get the crown off, save the aggravation. What's it going to look like after? And you put a big hole in the side of the tooth. It's not going to look right. And then it's weak. And you wonder, why is it coming loose to begin with? Angled. There it is. It's a hex screw. I see it. Identified on an angle, in shape. There's nothing stripped on it. It's just covered with composite. And that's the reason. That's it. Let me zoom in. I'll show you that hex. There it is. And there's cement inside the hex. Goodness gracious. This thing is... it's all covered. They got it, So, this is going to be a big job. We know it's going to be a big job. Taking the crown off. I'll probably here another 3 hours easily getting this off. But I want to take pictures. I want to prepare myself for this, and we're gonna. You need a rinse. You're okay? All right. We gotta figure the time. I don't even know how that's gonna work. What time? What's the best time? What day? Well. Look at that angle. It comes all the way out here. More toward the mesial.
Is that because it's an old style?
Yeah, the surgeon, question is what is it from? Well, the surgeon may have, I'm going to try some of these lever instruments. The surgeon may have had the only answer is, if he had to avoid the sinus, maybe that's what they were doing. I don't know. I don't know why. It's rare I see it like that angle. Guys, this is like a severe, 60-degree angle here. I'm just going to try to remove some more of this composite by hand.
Looking for something similar to this?
Yeah, now let's see how that fits. Let's see.
I have one that's a little more narrow.
Oh, this is good. Okay. Yeah, I'm just cleaning around it right now. Yeah. Well, we know why he couldn't tighten that if he were Houdini. He couldn't tighten that. It's on a severe angle. Okay, so if I'm looking at this and I want to save the abutment, I'm going to be prepping this ceramic off, get the crown off, and then gain access to the screw. So I'm confident enough to say that you got an angled situation here. Angled abutment. So I'm going to go off screen. I got to take some photos, talk to my patient, Dr. Jerry Cuomo. We'll be at it again for sure. At least we were able to get a diagnosis today, which is what you want. Take care.